Hi. In the following video, my colleagues and I will be discussing limb length inequalities. A limb length inequality is when two limbs have a difference in length from side to side. The following video will specifically be looking at lower limbs.
Leg length discrepancies are a common finding and are present in approximately 2/3 of the population and can reach up to 2 centimeters without causing any clinical symptoms.
Limb length inequalities can have many causes, some of which are listed here. Your treatment will vary depending on the cause of your particular limb length inequality.
Generally, leg length discrepancies of less than 2 centimeters are well tolerated. However, having a leg length discrepancy can cause an increase in back pain. It can also cause earlier osteoarthritis if you have associated femoral head uncoverage on the longer leg side. Additionally, it can cause a functional scoliosis as well as an inefficient gait and may cause contractures of the hip, knees, or ankle. The size of a leg length discrepancy can be measured through multiple different methods, including block testing, where you put the amount of discrepancy underneath the patient's foot until you level out their pelvis. You may measure it using a tape measure or using different imaging technologies such as X-rays or CT scan, which is the most accurate test when you have associated contractures of the hip, knees, or ankle. Leg length discrepancies can be managed through non-surgical and surgical options. Typically, non-surgical options are pursued for leg length discrepancies that are less than 2 centimeters. Generally, these differences are well tolerated, and if they are clinically noticeable or clinically relevant to a patient, then a shoe lift may be placed inside of the shoe as long as the difference is less than 2 centimeters. Once a difference reaches greater than 2 centimeters, but patients and families would still like the difference to be managed with non-operative means, the shoe lift will need to be placed on the outside of the shoe, generally added to the bottom of the shoe. Surgical options for managing leg length discrepancies include shortening of the long side, lengthening of the short side, or removing a physeal bar if that is the cause of the leg length discrepancy. Additionally, amputation and prosthetic fitting can be pursued for very large discrepancies. Shortening of the long side can be completed by epiphysiodesis, or stopping the growth through the growth plate. This can be completed through the femur, tibia, or both. Additionally, the long side may be shortened by removing a portion of the long bone. The shortening of the long side is usually performed for leg length discrepancies of 2 to 5 centimeters. Lengthening of the short side is reserved for patients that have leg length discrepancies that are going to reach approximately 5 centimeters or more. This is becoming more common with safer techniques becoming available, and in some cases is performed for discrepancies that are between 2 to 3 centimeters. Physeal bar excision is reserved for patients that have a bony bridge through their growth plate that involves a large portion of this, and the patient needs to have at least 2 years of growth left for this to be performed. Finally, amputation and prosthesis are reserved for patients that are going to have a significant leg length discrepancy, which is generally over 20 centimeters, and patients that have a non-reconstructible limb.
We hope you found this video educational. There are many more like it on the OrthoKids website. Thank you.